Do you have any specific tips for anyone who has had a stroke or neurological injury? I know you have a ton, but maybe you could share one.
Yeah, so I mean, we always, like to personalize care. So I think that's just like so important that like it's not a one size fits all approach. And if you're currently in therapy, make sure that you have a therapist that really listens to you and understands your goals and your needs. Because if they're just, making every single goal the same for all their patients, like they're not personalizing and individualizing the care. So it's really important to have that personal touch from your provider. But one of the strategies that I like to use with a patient who, say, has one side that's affected, is I love mirror therapy. So, having them do an activity with a mirror nearby, that way they're able to visualize and see the movement of the affected extremity. So that's kind of like one of my go-to for treatment if it's appropriate. And you could do all sorts of tasks. You could do fine motor tasks. You could do like some, functional, like putting on tops to containers, playing cards. Really, like, there's no limit on what you could do with that. Some people think, oh, you only hold like a weight and go back and forth or something. But there's just so many ideas that you could do, and you want to make it once again personalized to the patient. So, maybe they're a card player, so incorporate cards, or like incorporate their favorite snack they want to be able to open, things like that. So that's my tip.
And then also just making sure that you stay like more like higher intensity. Sometimes we're just sitting down and doing like leg kicks or I don't know, different kinds of things. But the more higher intensity, even if it's not done completely correct, you need to get that in there because you need to like retrain those pathways and stuff. We need to be doing the more walking and the stairs, the carrying heavier objects, like really kind of really testing ourselves. And even if you're not in therapy anymore, going to the gym or having like a gym in your house or just something that you could constantly be, really keeping yourself motivated and doing those higher intensity things, not just like the really basic exercises.
Yeah, I think just keep yourself challenged. If it feels
Yeah.
hard, that's good. That means you're going to make progress, and just keep going.
It's really the same with everybody too. If
Hmm.
you're just doing the boring exercises, you're never getting better. Like you
Exactly.
gotta do the things that challenge yourself and really add that extra into it.
Hmm.
I love that. Along with the mirror, I do like to do it in front of a mirror because sometimes when you're looking at yourself, you can see if you're doing it right or with good form. And then, as far as challenging yourself, that's a good one because I had to build myself up. I noticed I kind of get used to it. And then after a while, I got to push